In Minnesota, a massive fraud scandal is gaining national attention. Federal prosecutors say at least $1 billion.
Recent developments in Minnesota have brought attention to complex issues involving government assistance programs, fraud investigations, and immigration policy. Reports indicate that certain federal protections for immigrants in Minnesota have been under review, with policymakers debating changes to legal status protections.
Do you take responsibility for failing to stop this fraud in your state?
These actions have sparked discussions around community impact, accountability, and the management of public resources. Minnesota is home to a diverse population, including one of the largest Somali American communities in the United States.
Something wrong with him. Anybody that would do what he did, anybody that would allow those people into his state and pay billions of dollars out.
Many Somali immigrants are contributing members of society, participating in local businesses, schools, and civic life. At the same time, authorities have uncovered significant cases of fraud that have affected government-funded social service programs. It is critical to distinguish between individuals committing criminal activity and the broader community, which overwhelmingly consists of law-abiding residents working to build lives in Minnesota. The scope of fraud in social service programs. Investigations over the past several years have revealed that a subset of individuals exploited weaknesses in federally funded social programs, including those designed to support children, families, and people with disabilities. Among the programs scrutinized is the Minnesota Medicaid Housing Stabilization Program, intended to provide housing support for residents in need. Data shows that the initial program budget of approximately $2.5 million grew rapidly, reaching hundreds of millions in just a few months. Federal prosecutors noted that in some cases, fraudulent claims may have outpaced legitimate service use, prompting criminal investigations. Similar issues were found in programs supporting child nutrition, autism therapy services, and housing assistance, where some providers submitted claims for services that were never delivered. For example, certain child nutrition initiatives, often referred to collectively as Feeding Our Future, allegedly claimed reimbursement for meals that were never served. The program reportedly expanded rapidly, opening hundreds of sites and filing invoices that investigators determined were fraudulent. These cases highlight vulnerabilities in oversight and the importance of ensuring that resources reach the residents they were intended to help. Federal investigations and criminal charges. The U.S. Attorney's Office in Minnesota has been actively investigating and prosecuting cases of fraud involving government assistance programs. Reports indicate that dozens of defendants have been charged across multiple schemes, ranging from false billing for medical services to misrepresentation of housing and pandemic-related nutrition programs. Some prosecutions have resulted in significant prison sentences for individuals found guilty of orchestrating large-scale fraud. For instance, one case involved tens of millions of dollars in fraudulent claims through a nonprofit organization claiming to provide child nutrition services during the pandemic. Investigators documented fabricated attendance records, invoices, and enrollment rosters, which led to government reimbursements for services that were never provided. While the exact total of funds lost is still being assessed, officials have described the impact on taxpayers as substantial, with potential losses reaching into the hundreds of millions of dollars. Community impact and considerations. It is essential to emphasize that these cases represent a small minority within any community. Minnesota's Somali American population, for example, includes many families who are law-abiding, working hard, and contributing positively to the local economy and civic life. Statements by public officials have highlighted that the majority of Somali immigrants are engaged in normal, everyday activities and should not be judged based on the actions of a few individuals committing crimes. Maintaining this distinction is important in public discourse to avoid stigmatization and to promote trust within communities. Oversight challenges and political context. One theme that has emerged in the coverage of these cases is the challenge of oversight at both the state and federal levels. Investigators have noted that in some instances, rapidly growing programs lacked sufficient monitoring systems, which allowed fraudulent activity to occur before it was detected. Federal authorities have emphasized that, while local oversight is crucial, state-level officials also have a role in identifying and preventing misuse of public funds. political dynamics have occasionally influenced the pace and focus of investigations, as elected officials balance program management with constituent needs and public perception. This underscores the importance of transparency, independent auditing, and rigorous monitoring in government-funded programs to ensure integrity and accountability. Examples of fraud cases. Several specific fraud cases have received national attention. In one instance, a non-profit organization submitted false claims for child nutrition services, alleging that meals were provided to tens of thousands of children each day at sites that could not physically accommodate such numbers. Federal prosecutors detailed the creation of fake rosters, invoices, and attendance logs, resulting in the organization receiving reimbursements for services that were never delivered. Another case involved autism therapy programs where claims were made for services provided to children who had not been evaluated or diagnosed. These cases illustrate how program vulnerabilities can be exploited and the importance of ongoing oversight to protect both taxpayers and service recipients. Additionally, investigations into housing support programs revealed rapid and unsustainable spending growth, raising questions about program administration and accountability. These examples collectively highlight the need for continuous evaluation of social service programs to prevent misuse and ensure public trust. Allegations of broader networks. Investigators have noted that some cases of fraud were interconnected, involving networks of individuals working across multiple programs. In some instances, these networks spanned different social services and were coordinated to maximize financial gain from fraudulent claims. Federal authorities have described the operations as complex, requiring collaboration among law enforcement agencies, forensic accountants, and program administrators to trace the flow of funds and identify culpable parties. While initial media coverage sometimes highlighted the ethnic background of individuals involved, federal investigations emphasize that criminal behavior is not representative of any larger community, and that accountability measures target actions, not identities. Response from political leaders. Public officials at various levels have responded to these revelations by stressing the need for accountability, stronger oversight, and reforms to prevent future misuse. State and federal representatives have underscored that protecting public funds is a shared responsibility that involves policymakers, administrators, and auditors. Some politicians have called for additional resources to strengthen monitoring systems, improve program transparency, and ensure that assistance reaches the residents who need it most. These efforts reflect the recognition that complex programs, especially those handling large sums of federal funding, require careful administration and vigilant oversight to prevent fraud. Implications for federal immigration policy. The intersection of immigration policy and fraud investigations has sparked debate about broader policy decisions. While federal authorities have the ability to adjust protections and legal status for certain immigrant populations, policymakers emphasize that enforcement actions should be evidence-based and targeted at criminal activity rather than communities as a whole. It is important to balance the enforcement of immigration law with the recognition of immigrant contributions to society and to avoid policies that disproportionately affect law-abiding residents. Ensuring this balance is a continuing challenge for federal, state, and local governments. Media coverage and public perception. Media coverage of these cases has highlighted both the scale of fraudulent activity and the challenges of accurate reporting. Complex financial and legal matters, such as tracing billions of dollars across multiple programs, can be difficult to convey clearly to the public. Additionally, coverage sometimes risks conflating the actions of a few individuals with entire communities, which can lead to misconceptions. Journalists, policymakers, and community leaders have stressed the importance of providing context, distinguishing between criminal activity and lawful behavior, and avoiding the stigmatization of communities. Responsible reporting helps ensure that the public is informed without fostering unnecessary fear or bias. Ongoing investigations and reforms investigations into fraud in Minnesota continue, with authorities pursuing new leads and evaluating systemic vulnerabilities in social service programs. Prosecutors have indicated that additional indictments are expected as investigations unfold. Beyond criminal accountability, these cases have prompted discussions about program reform, including the implementation of stricter auditing procedures, enhanced digital tracking of claims, and improved training for staff managing federal assistance programs. By addressing both individual criminal activity and structural weaknesses, authorities aim to restore confidence in social programs while ensuring that resources are allocated efficiently and effectively. Lessons for governance and public policy. The Minnesota cases provide several key lessons for governance and public policy. First, robust oversight mechanisms are essential to prevent and detect fraud, especially in programs handling large amounts of federal funding. Second, clear accountability measures for administrators, program staff, and policymakers are necessary to maintain integrity and public trust. Third, communication with communities and the public is crucial to ensure that law-abiding residents are not unfairly stigmatized and that program beneficiaries understand the rules and protections in place. Finally, these cases underscore the value of collaboration between federal, state, and local authorities, as well as independent auditing and investigative journalism in safeguarding public resources. Conclusion. The unfolding situation in Minnesota highlights a complex intersection of social service administration, criminal investigation, and public policy. While a small number of individuals exploited weaknesses in government programs, the broader community continues to contribute positively to society. Federal and state authorities are actively pursuing fraud cases, implementing reforms, and strengthening oversight mechanisms to prevent similar occurrences in the future. At the same time, discussions about immigration policy, political accountability, and program management remain ongoing, emphasizing the importance of evidence-based decisions and careful distinction between criminal acts and broader community populations. Ultimately, these developments illustrate the need for vigilance, transparency, and integrity in public programs to protect both taxpayers and vulnerable populations, ensuring that government resources fulfill their intended purpose.